Hi, my name is Shomi Williams and I'm a therapist. Today I'm going to be answering some questions presented to you by MyCityPodcast. The first question is, what are your 3 top tips to maintain your mental health in a lockdown? So obviously these are unprecedented times, but what I can tell you is that number 1, first top tip will be maintaining your social network. So the people that you normally communicate with, that you normally meet up with, just consolidate that with video calls, texts, emails, whatever type of communication you want to do with all these apps available. Secondly, I would say maintain your alone time and privacy. It's a bit harder now. Houses are more crammed. There may not be the amount of space that you're used to, but we still need to make sure that you do prioritize intentional time to be alone, to collect your thoughts, to wind down, whatever it is that you need to do. I think it's really helpful. So whether that's going on a walk because the house is more crammed, or telling everyone very intentionally, listen, just let me have this space for this amount of time. And last but not least, your physical health goes hand in hand with your mental health. So when you work towards maintaining your physical health, you're doing the same for the other as well. So that means, your exercise. I know gyms are closed, but try and improvise. Your eating should, there's a lot more temptation to overeat with the fridge being readily available. And finally, your sleep. The lack of containment, the lack of structure can cause poor sleeping habits, which tends to affect your mental health quite poorly as well. So try and keep on top of that and notice any changes there. Okay, question 2 is, how much longer do you think that we can remain in lockdown before we see serious mental health effects or riots and other adverse effects? I think we're already seeing it. People are tired of the lockdown, understandably. In terms of how much longer can we remain in the lockdown, how long is a piece of string? It varies from person to person. As a society, as humans, we're not meant to be in isolation. We are very interconnected. So it's not surprising that people are getting fed up. Not everyone views the risk as the same. If you already had underlying mental health problems, it's possible that the lockdown exacerbates it and adversely could help it as well by keeping you away from negative stimulus. So I can't give a one-size-fits-all answer. It varies from situation to situation. So the third question is, from a biology point of view, why do you think people need to be in frequent contact with other people? I think, as human beings, we are as successful of a species as we are because we are social. Not because we're intelligent, but also because we're social as well. We're able to communicate with others very effectively. We're able to work together. I think it's just inbuilt in us, the desire for, warmth, for social acceptance, for validation, for love. Just different things that we need from each other, and practical things as well. No man is an island, as the quote says. So what you don't have, you do need from someone else. We can't work independently. So biologically, that's what makes us a successful species, and it's what keeps us, it gives us the need to see other people, which I don't fault at all. Obviously in the situation it's less than ideal, but it is what it is. So question number 4 is, why is having therapists stigmatized and negatively viewed in the Black British community, and what can be done to combat this? I think in general in the Black British community, we can see statistically that we are less likely to present to services, more likely to die of various diseases, and more likely to only present when we have the disease at a more serious stage. So already that shows a distrust between the community and the healthcare services, and also that there's also statistics looking at hostility within the NHS towards people of Black British backgrounds. So I think the distrust can be justified in that sense. I think if people have better experiences, so what can be done to combat this is actually just working on that level of institutional discrimination. If people have more positive experiences within the services, word gets around very easily. They become more trusting, the people around them become more trusting, people present more to whatever the service has to offer, so whether that is mental health or physical health, because I think there's a problem on both sides. I think the way that services are even marketed as well, I think that can be broadened to be a bit more inclusive, to feel a bit more like this is for us. I think, when a type of treatment, especially on the mental health side, is seen as less essential, people in general will not flock to it. So it is the job of the service to reach out a bit better, to make it seem a bit more essential than what it does seem at the moment. So question number 5 is, what advice have you got for someone that has the same career aspirations as you and wants to follow in your footsteps? I would say just message me. I think I got started by messaging someone, and they just broadened my understanding of the entry path into the career. What course I need to do, what qualifications I already need, and from there it got the ball rolling for me. And I think I'm more than happy to do that for anyone that wants that help. So it's not a secret. You can research online as well. Anyone that that's in the career path, just ask them, and hopefully the information is readily available. It is I'm having a good time so far in the service. So yeah, I would definitely recommend it. It's very rewarding as well. It's a really rewarding career path, so go for it. It does require hard work, but everything does nowadays, so yeah, I would recommend it. And last but not least, question number 6, what does being black and British mean to you? So to me, it's what it says on the tin, being black and British. That's what black British means. I'm black because of my Nigerian heritage. I'm ethnically Yoruba. I'm British because I was born and bred here, and that's me, black British. We have a lovely black British community in the UK, and we've kind of created our own subculture, which I think is very beautiful. We have a big community of Ghanaians, Jamaicans, Nigerians, Dominicans, Guyanese, Gambian, various African countries, various Caribbean countries, and it's nice. There's a kind of blend here, which is very lovely. So whether I like it or not, I'm very influenced by these cultures. This me being Nigerian and me being British, that is. And then further influence from the black British subculture in the UK as well. So yeah, both of those things make up who I am, and I'm very proud of who I am. So for more information, please check out My City Podcast, specifically episode 50. My name is Shomi Williams. I run a platform called Lafayette Health that looks into the mental and physical health of people from black British backgrounds. Thanks, bye.